So the last section that we're going to talk about here is about birth, growth, and aging. So in childbirth, there are three different stages. The first is that there's the dilation phase, and in the dilation phase, the cervix, which is the opening of the uterus, starts to open, and females can actually have really strong contractions, and that's basically the wall of the uterus basically forcefully and involuntarily, you don't have control, start just flexing over and over and over again to push this baby out. Now for most females, this phase called the dilation phase, when things just start to open up and the contractions start, normally this takes, a few hours for a female to deliver a baby. I actually have a little sister that just had her most recent baby in 3 minutes. So, in case you ever have a 3 minute baby, here's everything you need to know in rapid fire. It's like highly unusual. And then I'm sitting over here as her sister, and I had to have all C-sections. So you never know. You never know. You might have a sister that's Wonder Woman, and then you're just, it's fine. It's fine. Okay, so the second phase of this process, I want to point out before I leave this, at the end of the dilation phase, eventually the contractions can be so strong that the amniotic sac tears. This is called like having your water break, or the water coming, all the water that the baby was in is suddenly coming out. If that happens, the baby needs to be delivered really soon. Because infection can happen through that and everything else. So the baby needs to come out really soon. But the second phase is called the expulsion phase. And in the expulsion phase, the contractions will get stronger, and the baby will usually start to come out head first. This is the correct presentation, is to come head first with the baby facing the back of the mom. If the baby is facing another way, like breech, or facing up towards the mom, there's things that can go wrong in that. And sometimes that requires that there's a C-section, and we will talk about that in a second. But as the baby is pushed out through the, it's kind of in the uterus, but then through the cervix and through the vagina, sometimes called the birth canal, the baby will come out, and this umbilical cord that was attaching mom to baby will need to be cut. Once the umbilical cord is cut, on the baby side, it'll eventually fall off after, so many days or a week or two. It'll fall off, and it'll leave a mark, which is your belly button. And then the last phase is actually the placental phase. And in the placental phase, this whole set of like membranes that was surrounding the baby gets delivered by the mom as well and comes out. So if a C-section needs to be done because there's some kind of problem, the baby's head is really large and the mom's cervix is small, a baby being breech, etc., then the doctors will make a cut really low on the female and basically cut and pull the baby out of the uterus. They sew it up. These can be totally safe and fine for the mom. It's just a different way of giving birth. So in the first 4 weeks of life, the baby is called a newborn, and most newborns are about 51 centimeters and about 3,300 grams. Growth and aging. Okay, as you grow in age throughout your life, there's different hormones that will help that growth happen. So human growth hormone is one that helps you get taller and bigger. And it does that by increasing the rate of protein synthesis and breaking down fats. And it basically targets the part of the body and different parts of the body, and kind of keeps the cells in mitosis, meaning division, like their division state. So it divides them a lot, and that's how you grow with human growth hormone. The next one is thyroxine, which is made in the thyroid. And that basically increases your metabolism, meaning you break down food a lot faster. And so growth happens that way. And then there's various steroid hormones like estrogen and testosterone that help you have energy, muscle, all kinds of different things. So in infancy, this your book is defining as the first 2 years of life. Babies can roll, they can crawl, they can grasp objects, they perform multiple tasks. My kids had a meter inside of them that if I started to sit down because I was tired and maybe didn't want to hold them or interact with them, they would immediately start to cry. It was just amazing. Um, they can say a few words. A baby grows about 25 centimeters. That's a lot. It's like a foot. And by the end of their first year, they have tripled their weight. So if they were born at 7 pounds and they tripled, you're talking about by the end of the first year, they're 21 pounds already. And then a person goes through childhood, adolescence, this is when puberty happens, and then adulthood. Adulthood, your book, there's a lot of positive things that happen in adulthood, but your book doesn't point out any of them. What they do point out is that on the negative side, I guess if you want, yeah, these are mostly negative. Okay, your hair turns gray, white, you can get shorter, lose a few centimeters of your height. You decrease your muscle mass, your metabolism slows down, which means you get to eat less food for the same result. And if you keep eating the same amount of food, you're just going to gain weight. Pumping ability of the heart, the skin is less elastic, meaning it bounces back less, meaning you get more wrinkles. Your sensory perceptions, meaning taste, touch, sound, smell, is less. And women go through this lovely phase called menopause, where they lose the ability to have kids, but it comes with a lot of other things happen. So, if you had to make a chart on what occurs during the stages of human growth and aging, you could say that in infancy, growth occurs. The baby gets motor skills developing. In the adolescent phase, puberty begins and you have rapid growth. In adulthood, muscle mass decreases. You might become shorter. The metabolism slows, senses dull, and menopause for women.